Let's get going then. Very good. All right. Well, let me first, I said, we got this whole big banner up here. Got it. Got it. All right. They want us to know that we're recording for posterity. Well, welcome to the First Coast Free Thought Society's Zoom room. We are an organization of individuals who prefer science and reason over religious dogma and fanaticism. We've enjoyed the non-religious community of Northeast Florida since 1998. We are now in our 24th year. We're on Facebook, Twitter, Meetup. We have Secular Sunday in the Park, book and movie discussion groups, the Free Thinker newsletter, and which we invite your submissions. You can read about how to submit on our website, firstcoastfreethoughtsociety.org or fcfs.org. We really do invite your submissions. I got a question for some people here. Is anybody here new to the First Coast Free Thought Society? Is this your first time with us? If so, are you willing to share how you heard about us? Anybody new to us that wants to? If you want to speak, please unmute your mic at this point. Everybody's been here before? Okay, well, great. We are all, well, welcome back. We are all volunteers, yet we do incur expenses, largely promotion. We've promoted online, on the radio, and in print. If you know of a viable place for us to promote, please share. We also have some associated costs for our website and fees for regulatory compliance as our 501c3 organization. If you can see your way clear to offer a donation, $20, $50, or any amount, you'll be part of the reason we are able to continue our public outreach. We are tremendously grateful for all who have made donations and have become a member. We appreciate you and we need you. One perk of becoming a paid member of the First Coast Free Thought Society is the privilege of casting your vote for who sits on our board of directors in 2023. Ballots have been mailed. Mark your ballot and return it in the pre-addressed envelope provided, postmarked no later than December 1, 2022. Visit our website to read the October Free Thinker newsletter for the bios of the 2023 board candidates. At our most recent board meeting, we have 4 of them, one each quarter, but at our most recent one, we had our very first proclamation, where we unanimously proclaimed our admiration and our gratitude to Mark and Carrie Renwick for decades of unparalleled dedication to the First Coast Free Thought Society. In addition to the proclamation, a timeful token of our deep appreciation was presented. You may see the gift and read the full proclamation on our retrospective tab at our website. Our gratitude for Mark and Carrie and everybody who's been involved with the First Coast Free Thought Society over the years continues. Next month, Monday, December 19th, we will enjoy our traditional Human Rights celebration. It's a BYOB. It will probably be on Zoom, so you can drink in the comfort of your own home, your bedroom, wherever you want, but really enjoying our human rights celebration as we have done over the past 2 decades. And kicking off the new year in January 2023, we plan another Free Thought Free-for-All, where any and all topics are initiated by the people in the Zoom room. Now, tonight, we're very fortunate, we're very pleased. We're thrilled. We're excited beyond words. We are pleased to welcome Dr. Angela Mann, Associate Professor at the University of North Florida and President of the Florida Association of School Psychologists, who will offer a presentation titled The Culture Wars: Assault on Public Education. Dr. Mann's social justice research focuses on the disproportionality of marginalized youth whose access to public education has been troublesome or denied. Dr. Mann advocates for abolishing out-of-school suspension and the examination of school-based policies and practices which contribute to the school-to-prison pipeline. Toward that end, she has partnered with the ACLU, the Southern Poverty Law Center, and many others. A discussion will follow Dr. Mann's presentation. Should you prefer, you may message a question via the Zoom chat. Please mute your mic until it's time to speak. Everyone who wants to speak will be given ample opportunity to do so. So please know we are recording, as we heard earlier, for posterity. So let's enjoy the time, expertise, and the insights graciously offered to us by Dr. Mann. Angela? We are all yours.
Thank you so much, Ken. I think that is the most enthusiastic welcome I've ever been given to one of these talks. That was wonderful. Thank you. And I guess I should probably raise my hand because I am a new member myself, and this is my first time attending live. I had a chance today to, and actually over the last few weeks, review a few of the other presentations you all have had, and they're really cool. I really enjoyed the one around advocacy. So I feel really honored to be amongst all of you today. I have not gotten a chance to meet, but also feel like I know Susan, and I don't even know how to pronounce her last name, Erica. So Susan, I've seen you all over everything education in Jacksonville, and I'm just so impressed with your advocacy. So I'm really looking forward to tonight. I know I can tell, obviously, this is a very thoughtful group. So, and I will just preface this talk with saying that I obviously don't have all the answers. I think if I did, I could heal the world or something, right? But I can definitely fill you in further on the experiences that I've had over the last year as the president of the Florida Association of School Psychologists, which I'm now officially past president as of a week ago, and just kind of what we're seeing and what I believe will potentially be on the horizon. So I'm going to start with a presentation, but I do want this to be more of a discussion. So feel free to jump in at any point in time if you find yourself kind of with a thought-provoking question or thought that comes to mind. And then, yeah, I hope we can have definitely some good discussion at the end. So let me just share what I've put together for you here. And a lot of my research methodology tends to very much center on kind of a storytelling approach. And so that's what I'm going to do here tonight a little bit. And as Ken mentioned, the topic tonight is going to be the culture wars assault on public education. So I thought it would be helpful because I'm not sure what the lay of the land is in terms of what everybody's understanding is of what public schools actually look like today. There's a lot of discussion in the media about what I think the public thinks that schools look like, but I think it's really important to start with just understanding trends and where we've been, maybe over the last decade or so, especially. So one trend that has been increasingly over the last, like I said, maybe 20 years or so, but definitely the last 10 years, a big focus in education has been what we call the school to prison pipeline, which is what I research. And the big thing with the school to prison pipeline is that you can see that, especially as we hit the 90s, we started to enact these policies in schools that were very much pushing youth out of schools. And so instead of maybe addressing, underlying behavioral or social emotional or wellness concerns for youth, what often happens in schools still to this day, although we've, as you can see here on the graph, been doing better, is we push kids out, either through giving them an out-of-school suspension, sometimes giving them an in-school suspension, which there's a lot of variability. Sometimes that can lead to therapeutic outcomes. Kids get in touch with a tutor and they, are able to receive interventions to help make up maybe academic gaps that they have. But in most cases, they're sitting in a room with, like the football coach who's telling them to sit down, be quiet, you're in trouble. And often they're not actually able to make up that work. So they fall further behind. And then in more extreme cases, arresting youth out of schools. Here in the state of Florida, we've seen Baker Acts, which is the involuntary commitment of youth, also becoming a tool for pushing youth out of schools as well. And so what happens is just one of these occasions of an out of school suspension leads kids to being much more likely to end up in juvenile justice, more likely to drop out, just a number of really negative outcomes. So like I said, over the last decade, we've really focused on this. And as you can see from the chart here, this was not happening and has not been happening, continues to not happen, equally across the board. And so Black youth in particular have been especially targeted by these policies. And I've given trainings, across school districts discussing these things over the last decade. And there are times when I've had educators or other, professionals in school say, well, Black kids just behave differently. But what we know about these trends is that these suspensions tend to be for very subjective behaviors. So initially, this was developed to address violent behaviors in schools, but what most students are receiving suspensions for out of schools are things like disrespect. And I'll give you an example. When I was a school psychologist in a school, I'm now at a university, I had a student who was maybe 12 years old. We had just started kind of working with the teacher and the student and the family. He was placed with relatives. His grandmother and aunt were caring for him. And it had become very clear that they were struggling to kind of meet his needs. He was out roaming the neighborhood. They couldn't, kind of get him to follow the rules of the house. And this was definitely playing out in the classroom. So, maybe several weeks into starting to talk about assessment and intervention, this guy cusses out his teacher. And the principal says, I can't leave him in there. For this teacher, this is too much, right? And so he suspends him out of school. And that student then ended up going home for 3 days, where again, we knew the grandmother and aunt couldn't manage him, and he set fire to several houses in the neighborhood and ended up in the juvenile justice system. And I see Mary was asking about the chart. This chart is national trends. This is, and I'm sorry, I didn't share data here, a link here, but this comes from a report from the UCLA Civil Rights Project. I think I have the link here in a second for you. I try to include all my sources, but if I'm missing one, just email me at the end and I'll get it for you. So yeah, at one point in Florida, we were actually leading the country in this trend. So this was around 2014, I believe. And so schools really started to say, we've got a big problem here. We need to start working on this. And the federal government stepped in and started to say the same thing, right? Like, we need to start talking about this, talking about why this is, and fixing this problem, because this is impacting our graduation rates, it's impacting our workforce, right? It has all these ripple effects in society. And I'm just showing you kind of some other trends here. As we started to intervene and, we have this Office of Civil Rights within the Department of Education, and they started to really come down on states and districts that had these huge gaps between outcomes for Black youth and white youth. Guidance started to be released, especially, you might remember, under the Obama administration, we had the Brothers Keeper initiative, and that was really meant to target these issues, right? So this is just important context. This also really affects students with disabilities. So believe it or not, I know sometimes like my family is like, what do you mean students with disabilities aren't schools helping those kids? But what we know is that those kids tend to be pushed out at greater rates than other youth as well as our LGBTQ youth. They also are much more significantly impacted by these policies than others. So this is the kind of conversation that we have around this in schools. This model is a pretty widely used model for trying to understand this disproportionate discipline. And we can also see this in academic outcomes as well, that there are these disproportionate academic outcomes. You might have seen this recently in Florida news in terms of reading outcomes for Black youth. So the model basically says, okay, we have this thing, we have these proximal outcomes, disproportionate discipline. And when we kind of peel away the onion, we can see these malleable predictors, things like school policy and school practices, that are, impacting this. So even things like dress codes, when you look at dress codes, you might have seen in the news things about students not being able to wear dreads, or, there are things baked within these school policies and practices that likely lead to some of these disproportionate outcomes. Then if we kind of peel it away even further and get into the more less malleable predictors, what we see is that schools are essentially a reflection of communities, right? I mean, everybody that's working within a school is living in our communities. And we know that there are things that continue to exist within our communities, like structural variables that are, driven by racism, like school funding formulas, for example, that mean that the kids in my neighborhood have very different resources when compared to kids on, let's say, the north side of Jacksonville. So those students tend to have less experienced teachers, higher teacher turnover, and just significantly less resources when compared to kids in other neighborhoods. So there's some evidence that school segregation is actually getting worse, and they've done studies to take a look at this. So there's actually a study that they did looking at educators, and in terms of explicit bias, which is essentially racism, that's another term for that, or implicit bias, which is something we all have. So, I might consider myself a feminist, and yet when I think about doctors or lawyers, I might default to male pronouns, and that is my implicit bias, right? That has kind of grown with me as a child, being exposed to certain things within my culture and my community. So many of us have implicit bias in educational systems, right? And that's something that certainly influences this process. But there are as many as 30% of educators in schools who actually endorsed openly racist beliefs. And we've seen this play out as well in our local communities. So you might have seen this past year in Mandarin High School, there were students saying that they had teachers using racial slurs. We've seen students taking pictures recently with racial slurs within them. So we know this exists, right? And we in schools did start talking about racism and bias. And that kind of, I think, sets the stage for this discussion today about like, what is this whole CRT thing? That being said, we're not talking about CRT in schools. So I'll get into that more a little bit later. What happened from there is as this kind of swing started to happen nationally in our greater culture, again, schools being a reflection of the greater culture, they started to be impacted by this. So when Trump took power, what we saw is that Office of Civil Rights, the website was entirely scrubbed, right? Any mention of the things that we had discussed earlier in terms of, examining bias in policies and practices and addressing disproportionality were entirely scrubbed. The data sets that we typically use to look at these things were put on pause. So it really created this chilling effect already in terms of beginning to address these concerns. So this goes back probably beyond even what people might be seeing, thinking in the last couple of years that this has kind of happened. So other things happening in schools that are important to know about. This is data from the Center for Disease Control, and they do this youth risk behavior surveillance survey every couple of years in major districts within the United States. So Hillsborough County, Jacksonville, Duval County, we've all participated in these surveys. They've been doing these for something like 30 years. So we're able to see national trends, and we're able to see state by state how we're stacking up for youth in terms of risky behaviors. So things like sexual behavior, substance abuse, mental health concerns. The other piece of this study or this, survey that's really important to us as mental health professionals. I should have mentioned earlier that I'm a former teacher, school psychologist, right, and a child psychologist as well, is that this data allows us to look at disaggregated data for youth who identify as LGBTQ and racial ethnic minorities, and so, or, marginalized groups. And that's important because it's really hard to get that kind of data. If you look at like the Florida Department of Education's data, we don't ask students in schools to identify as LGBTQ or not, probably is a good thing. And so it's really hard to study what's happening with them in terms of bullying or suspension. So this national survey is kind of trusted by these groups and gives us that important information. All right, so looking at these trends here, this is kind of like an overview snapshot of how data has looked across time. And again, this is the national report. I didn't pull like Florida specific report. We could do that, but this is happening nationally, not just in Florida, although Florida seems to be at the epicenter of it. So you can see that the trends are generally not good. And we've been talking about this for a while in terms of, school-based mental health professionals. So some things have improved over time, in particular violence, dating violence, sexual violence. Those things seem to have improved over time. But despite that, kids are reporting more than ever that they feel unsafe at school and that they're even not going to school because of feeling unsafe. Bullying rates have, slightly increased, even through the pandemic. It's a different age. I could leave school and basically go home, and as long as I didn't answer my phone, the bullying could stop, right? Not the case for kids now. And mental health concerns have continued to grow for kids in schools. So this is students who were threatened with a weapon at school. I just pointed this one out because it's a little tricky, right? So the CDC says, oh, this is a green. We're not concerned about this trend. Well, I don't know. To me, this is a pretty big deal, being threatened with a weapon at school. And yes, the trends over time over the last decade haven't changed when you just look at 2009 to 2019. But when you look in between there, we were doing better there for a little bit, right? And then the numbers started getting worse again. When we look at mental health trends, they're all tanking. And this is pre-pandemic. So that's also really important to note, right? Because what have you heard since the pandemic has started about youth mental health? Not good, right? I'm not seeing people answering, but I'm sure you know that we now kind of know and understand that it has gotten much worse through the course of the pandemic, probably for all of us, not just youth, but one of the biggest buffers to stress is social connection, and that's been limited. Even if you lived in Florida and were able to pretend that the pandemic didn't exist, your social connections were still limited throughout this time, right? Mary, I see your hand raised.
Yeah. Um, I don't know. I guess I've heard stuff about, people, teachers complaining about the difficulty of the job and stuff. It seems, I'm an old fogey or whatever, but I guess it sort of seems like to a great degree that parenting kids seem to have fallen on the school system, and it's not just education, but parents, I guess, nowadays they're both working or something. I guess I was considering, just the idea of maybe shortening the work week. But so maybe that both parents could maybe take their kids to soccer practice or something, or play more of a role in disciplining their own kids and more or less putting out public the school system. I'm not really sure teachers are prepared to do that, and I've wondered if maybe that's part of the problem, as well as I guess the COVID or whatever.
Yeah, I mean, it's so complicated because we see that this was actually getting worse well before COVID. And I think you're hitting on a number of kind of societal cultural issues that have probably impacted this, like both parents working, the wealth gap increasing dramatically for parents. So they're having to work even more than they were before to make ends meet. I work in private practice. Kids are scheduled out in ways that like I can't imagine living in that schedule, in that world. We see technology playing a factor in some of this to a degree. There are so many factors that play into this, and that could really be its own talk, like a whole other evening. But I do want at least to kind of understand, there is really this crisis happening. And what we're seeing in the news, we'll get into that more. I don't want to steal the thunder for later, but yeah, this is important to be kind of thinking about. And I see Kevin has his hand raised as well.
Yeah, I'm sorry to interrupt. I had a particular question about this slide, and I kind of wanted to ask you, based on your professional knowledge of this, and these increases on this particular one, what is your feeling or sense of how much of this is actually an increase in those versus an increase in the willingness for people today to talk about these? Because I know when I was younger, nobody talked about mental health. If you were depressed, you kept it to yourself. If you were feeling, anxious or whatever, you suppressed that. Whereas, people today, younger people today seem more willing, and I think that's fantastic, quite frankly, that they're more willing to open up about that, more willing to talk about it. What's your sense as to what portion of that, I guess, is this increase?
Yeah, this is another really important factor. And I love being with this group because already is so much like critical thinking around this. It's hard to say, right? Because like you said, it's not like we can compare, you're kind of comparing apples to oranges when you look at these trends across time, because what we do know is that this younger generation coming up is much more likely to seek out mental health services than any other generation, right? And they're much more willing and open to talking about mental health needs than any other generation. We still have a lot of stigma to deal with, but
Sure.
things seem to be getting better, right? So yeah, it's hard to say to what degree these trends are, influenced by that. But what I will say, and again, I wish like we could do a whole talk on this. I'm happy to come back, Ken, just for your notes. But what we see is that there are cultural factors that do seem to make these things worse. So one of the things that I was planning to talk about here, and I think someone asked if these trends are disaggregated by race. Yeah, when you go into the full report, you can see trends across race. You can see trends for LGBTQ youth. And I'll even pull those up here in a second. One of the things we know is that in the last couple of years, when all of this anti-trans legislation started coming through, we were seeing declines in suicidality trends for many youth in Florida, and now we're seeing an uptick. So there's probably an interaction happening here of these youth being more likely to seek out these services, more willing to talk about these things and identify them, but also maybe some things happening culturally that are telling us that we need to take a better look at our the way we treat youth, right? You could even think about things like our high pressure, high stakes tests that we now have in schools that youth didn't face previously, right? Nope. And I see lots of kids coming to me with like full-blown kind of anxiety disorders around just the tests themselves. It's generalized out to other things, but that pressure has certainly influenced their mental health. So it's hard to tease this all apart, but the bottom line is the trends are not looking good, right? And where I'm going with this is I'm not sure how much we're paying attention to them, and I'm not sure that that isn't strategic, but Mary, go ahead.
Thank you.
Yeah. Oh, sorry. I'll go back here. Oh, too far. Mary, yes. Oh, maybe I see her hand raised. Maybe it was an accident. So yeah, I mean, the bottom line here, when you kind of look at these
Mary
trends,
is muted.
Oh, Mary is muted. Mary, I don't know if you're talking, but you can unmute yourself. Oh, I'm advancing slides again.
Well, we can move on because we can do a lot of questions. There's going to be plenty of time at the end for lots of discussion and questions at the end.
Okay, perfect. Perfect. And yeah, someone had asked about like disaggregating the trends by race. One of the most concerning trends really actually with some of this data is that, like I said, suicidality was relatively stable for many groups, right? With the exception of Black youth. What we've seen is that over time for Black youth, there is increased suicidality, and it really seems to map on with the incidence of hate being documented in the country, right? And we are seeing, like I said, those similar trends for LGBTQ youth. So here we're getting specifically into data for LGBTQ youth, and you can see, I think one of the things that's really alarming about this is that the outcomes for LGBTQ youth are just so much worse than their, heterosexual counterparts. And I think again that this is notable because these are the groups that have been pretty seriously targeted by these culture wars, and they obviously have impact. So I'm gonna this is really meant to just start getting the juices flowing. The other big things we're seeing in schools right now, that big discussion has been around shortages of mental health professionals in schools. So there is an issue of us in training programs not producing enough school-based mental health providers like school psychologists, school social workers, school counselors, school nurses. But there's also kind of an issue with our allocation of funds. So this was a report that I was part of with the ACLU. And what we've seen is that over time, as the school to prison pipeline phenomenon kind of took hold with, we could say maybe our last culture war, the funding went with it. And so the funding has been put pretty significantly into school security measures, putting police in schools. And as you all saw here in Florida following Parkland, one of the first places that the legislature went to was creating basically this really beefed up allocation to put school safety assistants in every school, and to make sure that there was a police officer in every school. So there are now actually more police in Florida schools than there are school psychologists in Florida schools. And, again, this could be a whole other talk, a whole other evening, but I think it's important to just see that these culture wars have these long-term consequences. So I'm kind of jumping around here, but where a lot of the school to prison pipeline stuff came from was this narrative in the country around super predator youth. I don't know if any of you remember this back in the 90s. The Clintons actually kind of campaigned on this issue. So you might have seen the documentary or the movie on Netflix about the Central Park Five, these 5 young Black men who were roaming through Central Park at the time when a woman was sexually assaulted. They were wrongly accused and faced a ton of prison time. And they were really part of this phenomena that had blown up in the media, that there were these super predator youth. And reading between the lines, this was looking a lot at the poor African-American population that were roving these school buildings and were violent. And so in the mid-90s, we passed the Gun-Free Schools Act. And that's where these zero tolerance policies get enacted, where we start pushing kids out of schools. And here we are decades later. And we're now trying to undo that because we've seen that these policies that were maybe well-intentioned at the time really had these very negative ripple effects. So that's where I'm kind of bringing a lot of this in. And someone mentioned, I think Mary might have been the one who mentioned that we have a lot that we're putting on teachers, right? We have these kids coming through the system. And I've talked to people post-pandemic that are saying, I have never seen behavior issues like this in all of my teaching career. My sister's a teacher, I'm a former teacher. And I think some of it is, we call it dysregulation, where when you've kind of in some ways gone through you could, I mean, it might sound dramatic, but when you're a kid, a semi long-standing traumatic event for a while, you're dysregulated, right? It impacts your brain development. And so, yeah, teachers are being asked to do a lot. And we've seen these trends in kind of burnout and teachers leaving the field for some time, but it's gotten much worse over the last couple of years. You all probably saw in Duval County this past year, I think there was something like 500 openings that they were like desperate to try to fill. Susan would probably know better than I would, but yeah, it's creating a big issue for our teachers. And teachers are not in it for the pay, right? They're in it to help kids. So obviously, this should be sending out some alarms that, you know, teachers feel, I think, kind of helpless at this point in really addressing the needs of kids. So there's this like crisis happening, right? And I think we were really starting to talk about this, and it was getting a lot of attention. And following Parkland, the narrative was very different, right? The narrative was kind of like, this is a mental health issue, which has issues with it too, right? Because we know that school shooters, generally, it's not a mental health issue, actually, but it was good that as a country, we started to really talk about this. And we started to say, you know, kids have this mental health crisis. Casey DeSantis, when they campaigned, the DeSantis' campaign, Casey DeSantis' whole platform was children's mental health and getting mental health education in schools. So this became a big focus. And I just wanted to share a few more stats with you all. So the reason that mental health is particularly important in schools is because all kids are there, right? So we know that across the board, only around 20% of kids who need services, and generally that's about 1 in 5 kids, will actually receive those services. And this is even kids who have private insurance. Thankfully, in Florida, we have mental health parity laws. That means that insurance has to cover mental health services, but, you know, covers maybe defined loosely. And so even for kids who have insurance, they can't always access mental health services. So the kids who do end up receiving services, that 20% of youth, most of those kids are actually getting those services in schools. And yet, this recent survey of school counselors after the pandemic, and I see I'm missing a citation here, I'll get that to you. Almost 60% of schools said, there's no way we can like really, you know, or I'm sorry, around half of them actually said that they felt like their schools could actually provide those services. So that's a lot of schools saying, we can't do this, right? We're not well equipped to do this. Okay, so again, this is not exactly why you invited me here, but I want to set the stage. Where that leaves is this most recent report. This just came out last week. And nearly 5,000 students in Florida have been committed using the Baker Act. This is that involuntary examination of youth. So these kids are identified as being in crisis and either a harm to themselves or others, and have been sent to a hospital for evaluation where they can be held for 72 hours and potentially longer if they're seen to need more services. And this is preventable, right? This is when kids need this, they absolutely need it, and it's good that we have it, right? But my thing as a mental health provider is that this could be preventable. And it's traumatic for kids. It's traumatic. The last piece here is that I get asked this question a lot as well. Even though we've seen, generally speaking, violence decreasing in schools, we have seen these mass shooting events pretty dramatically increasing. The year before I graduated high school, to date myself, was Columbine. And before then, I don't remember ever hearing about this, right? And the way that kids are growing up now, to kind of get back to what Kevin was asking about, like, is this a cultural thing? Have we just shifted? I mean, I think about sending my daughter to school and having active shooter drills. I had kids after the Uvalde incident, friends of mine, their kids said, don't worry, mom, I will pretend to be dead like the girl at Uvalde if anything like this happens in my schools. So you think about the toll that that takes. and these students saying they don't feel safe in schools, right? Like this is this crisis that keeps me awake at night. Okay, so now we're going to get into like the culture wars piece of this. So in the last couple of years, this was in 2021, what we saw is really this like sweeping anti-trans legislation that hit across the country. And I don't know to what degree it was really picked up outside of education circles. And again, I feel like this was kind of maybe intentional. This is a very small population. It's a kind of low-hanging fruit if you're someone who has lots of hate to kind of publicly attack this group and say that we are going to create more moral schools for kids, right? A more moral, Christian, wholesome school environment for students. So this already was happening. And in 2021, we were fighting some of the anti-trans legislation going through, much of which was targeting athletes, if you might remember, or using bathrooms. We actually have a student here in St. Johns County that appealed some issues with bathroom use all the way up to the federal court system and won. So this has been an issue, but then this whole critical race theory kind of takes off, right? This becomes this huge narrative. And Trump, I think, was maybe the first to mention it, going after now I'm gonna, why can't I think of the name? 1619 Project? I'm losing my mind. Yeah, sorry, it's been a long day and I'm on cold meds. So this is really the first kind of entry into like the public narrative that I am able to see in the media of critical race theory. I am actually someone who researches with critical race theory. So I can tell you a little bit about this. This is not something I've ever heard discussed in a school building. I might be one that would say, I would actually love if we weren't talking about these in schools, but we've never been so brave or so bold as to actually discuss critical race theory in schools. And essentially what critical race theory says is that there is a system of racism. It doesn't necessarily say that, like, you know, white people are all inherently evil and racist. That's not really what this theory is about. This came from the legal field, and it came as a way of talking about how these systems maintain these racist, disproportionate outcomes for Black people in particular, but it's been now applied to lots of other groups. The way that I look at or investigate critical race theory is the way that whiteness impacts our culture as white people, right? So it's a means of examining culture, examining racism, examining, in some cases, disability, LGBTQ rights. And yeah, we've never been bold enough to talk about these things in school systems, for sure. So where did this all come from, right? How did we start talking about this? Well, this Education Week piece, I think, is a good kind of introductory piece to this. And they get into, again, where this was first brought up by Trump and how this was a means of essentially creating another one of these like moral panics in the education system. And when you look at, when you talk to education historians, we've had these over time. This is not like a new thing, right? But this is the newest. And you guys, I'm sure, know what happens from there here in Florida. So, we have the Individual Freedom Act that's introduced this last year. And this Individual Freedom Act, also known as the Stop Woke Act, basically says that even for private corporations, so not just in school systems or in universities like where I am, but even for private corporations like Disney, they are not allowed to basically do any kind of discrimination training. And so it's meant to stop what these groups that have been kind of running this campaign talk about as wokeness. And Disney, I think, was the most famous example of this. They kind of, DeSantis went after them, right? And again, there's just so much irony to all of this. They were apparently married at Disney World. And then, you know, I mentioned earlier, Casey DeSantis's whole thing was mental health for students in schools. And we have this big 180, right? So that's one piece of the culture wars in Florida. We see the Don't Say Gay law. This was another big one, House Bill 1557, that passed this last year in Florida. And this is having really significant impacts in schools. So the Individual Freedom Act, the Stop Woke Act, I think is having impacts in schools. I know that from talking to people who work for the Department of Education, they now have to have every single PowerPoint that they do, every word, they have to have it scripted out, and it has to be reviewed by the department. So not a lot of free thought happening at the Department of Ed these days. And they're scanning for things like, there's a list of words: equity, racism, disproportionality, that they're not allowed to use anymore. With Don't Say Gay, we see that not only, you know, the law itself says you can't educate students in K-3 on sexual identity, basically, right? Or developmentally inappropriate kind of sexual things. Well, it's intentionally vague, and it's been meant to be this vague so that districts like Duval County shut down their sex ed curriculum. And teachers are now afraid of whether or not they can have a safe space sticker on their lanyard, if they can have their picture of them and their partner on their desk. So it's created a massive chilling effect. But the other thing that was within this law was regulations around character education for youth. We were very concerned at first because we thought that the way the law was worded initially when it hit the floor was that any kind of mental health education whatsoever, it seemed, was no longer allowed. That's not the case, thankfully. But one of the other big things within this law that doesn't get talked about a lot is that parents have to give permission for any kind of screening tool that the school does. So we use screening tools sometimes like the Youth Risk Behavior Survey system. The American Academy of Pediatrics just recently recommended that all kids basically be screened for anxiety disorders. That would be something that we could do in schools because, again, we have all kids there. Screen kids, see who's at risk, identify them early before it becomes an issue, and get them services. All of these things now need to be vetted by parents and signed off on, which is fine. We've basically already been doing that. But given these other cultural happenings where parents feel their kids are being indoctrinated, where they feel that, mental health wellness curriculums in schools are meant to turn their kids gay, it's now become an issue, right? Where previously we'd get permission for these things, parents probably honestly didn't even read them, which is its own problem. And we do screenings and move on. So it's had a lot of effects. I've had school psychologists, supervisors in districts say to me, can I still do a suicide risk screening for kids? So we now have our school-based mental health folks trying to figure this out and make these decisions in crisis situations. And unfortunately, the Department of Ed has not released any guidance to indicate what this developmentally appropriate looks like. They really haven't released a lot of guidance on the screenings. And so basically everything has kind of screeched to a halt while this crisis continues to bloom and spread. So that's why it was important to get that first part kind of understood. And Mary, I don't know if you are still wanting to talk, but feel free to unmute yourself. Okay, so this kind of, I had an opportunity to actually talk to Rolling Stone about this. They've done really excellent coverage of what's been happening in our state. And she really documented well what's been happening with a lot of school-based mental health professionals. And basically, I've had people leave the field. I've had folks leave the state. I've had some just say, I can't do this anymore, and went into private practice. And so we already had the shortage, and now we've got teachers, mental health professionals fleeing because they're afraid, that they're going to lose their license. Some of their supervisors have said they'll be charged with a misdemeanor. No idea where that came from. But basically, folks feel like they are scared now to do any kind of services because they could be sued, lose their license, all of these things. And then, of course, there have been more subtle attacks as well. So I'm sure you've seen the book bans that have been taking place across the state and really across the country. Florida now, as of last data that I could find, ranks second among states with the most book bans. And then I mentioned that youth risk behavior survey at the beginning. Another crisis that took place this last year was Florida and several other states, I think it was 3 other states, announcing that they were withdrawing from youth risk behavior survey data collection. And all the state has told us and said to the media is that they feel like they need a more Florida-specific tool. And that basically they didn't feel like some of the questions around sexual behaviors were appropriate. What's interesting about this is that all states have the flexibility to choose the items that they put on the survey. So it's not like there's a mandated survey that everybody gets. So they could already make their own Florida specific survey. But the state is now apparently working on their own tool. There's been a big coalition of us fighting to get the tool back. We all tried to kind of get on this task force to at least influence what this new tool is going to be. And I am not sure that the task force actually exists. Supposedly this is going to be released in the spring. We have no idea what it will look like. But one of the big issues with that is that we use this tool to compare to national trends, which is important for things like grants. So Duval County has been the benefactor of some really big grants around mental health. And that is because we were able to look at this YRBS data and compare it to other large urban districts and say, there's a big need here and we need more resources to support the needs. So it's a big issue, right? I'm just looking here at some other, yes. So Joanne, I'm sorry, that question was probably a while back. Yeah, the suicidal ideation figures are broken down by race in the report as well. And that Woke Act was blocked in federal court today. So it was blocked for education. So it was initially blocked, I think maybe a few weeks ago for businesses. And now it's finally been blocked for education. We're all really thrilled about that. You can ask me at a later date about post-tenure review. That's another fun battle happening in the state related to the culture wars. It's being appealed. The state has said they're going to appeal the block, but we're going to enjoy it while it lasts. And hopefully it just continues to last. That judge was fabulous. Okay, so other things kind of happening around the same time as the withdrawal from the youth risk behavior survey. The state announced that they were going to ban Medicaid coverage of gender affirming care. And so, very few pediatric cases of like full transitioning from, one gender to another. What happens most often for pediatric youth are things like hormone therapy. So when the state decided to remove this from Medicaid coverage, what that means is all the other insurances then will follow suit, right? And remove coverage of this. So that was officially voted on this past week by 2 medical boards that are largely slacked by DeSantis supporters. So yeah, there's kids who have already been showing really disturbing trends now are being targeted. And I think what is even more concerning is, well, maybe not more concerning, but equally concerning is that one of our biggest tools for preventing mental illness and creating wellness for youth is what we call social emotional learning. And so this is we could say intervention, but it's really meant to be kind of a curriculum that's delivered to all students. My toddler is getting social emotional learning at her preschool. And basically what this means is that she's taught about her feelings. She's taught how to label her feelings. And so when she goes to bite one of the kids on the playground or whack somebody because they took a toy, they teach her to say, I'm frustrated, or stop. I am still playing with that, right? That's still my toy. She does this thing now where she blows bubbles. So it's her way of taking deep breaths and regulating her body. And then she pops the bubble. So that these are the things we teach kids in social emotional learning, right? How to identify their feelings, how to regulate their feelings, how to problem solve with peers. There's some social skills baked into this as well. And there's always been a need for this, but especially following the pandemic, where, the data is showing that, teachers, educators, school counselors are saying kids are more dysregulated than ever. We're seeing kids with, really problematic social skills more than I've ever seen. This type of curriculum is more important than ever. And following Parkland, everyone was in agreement about this, right? We didn't want to talk about guns, but we were happy to talk about social emotional learning and how important this was for getting well-adjusted kids in schools. And now schools are not even allowed to use this term anymore. They have to say that they're doing character education. They're not allowed to say that they're doing social emotional learning. Many districts have actually pulled their social emotional learning curriculum because these Mothers for Liberty type groups have come in and in some cases even stalked, kind of harassed some of these school-based personnel. So the biggest tool we have for preventing mental health is now being removed from schools. And this is really like the one for me that I don't know. I can't wrap my head around. And I've talked with people like, how do we address this, right? Like maybe if we just show them the curriculum, and I've had districts do that. They've shown the curriculum to some of these groups with these concerns. And even after seeing the curriculum and seeing that there's nothing about, turning kids gay or sexual identity or these other concerns, the outrage remains. So I would love any ideas you have for how we can get this back, because we really need it. And it's going beyond that. So in Alabama, school counselors were actually targeted. They actually in legislation tried to basically do away with school counselors in the state of Alabama, because the media had kind of started to basically go after school counselors as being, indoctrinators of youth. And then actually, even in the last couple of weeks, we've seen this shift to school psychologists. Thankfully, that seemed to have died down, but we had a congressional group, several representatives actually write to the South Carolina Department of Education and said, please basically divorce yourselves of the school psychologist, because our national association has been very pro LGBTQ youth rights throughout all of this, right? And I can tell you from having worked with the South Carolina school psychologists, one of their leaders actually said to me, we don't need this social justice stuff here in South Carolina. Like, we're good on that, right? So this was not an out there group. Like, this group was very much probably aligned with a lot of these beliefs, but because of what the National Association had done, they tried to cut school psychology out of the school system. And then just recently, one of my last acts actually as president was trying to get a proclamation for National School Psychology Week from the governor's office. That was National School Psychology Week was just a couple of weeks ago. And our lobbyist said he'd never seen anything like this happen. But we were denied the proclamation for no apparent reason. But I have been told that we are on the governor's radar because we have vocally opposed House Bill 1557 and some of these other initiatives. So it's, happening at other levels as well. And I just want to kind of point this out as well, because I think it's good to put heads together about how we can maybe get a handle on this culture war. So I know, being in the university system, that our board of governors is now kind of being stacked with folks who, support the Stop Woke Act. UF they've kind of uncovered some recent controversies at UF that seem to also suggest this is the case. They've dissected the recent school board elections and found that this is the medical board I was talking about earlier for gender affirming care, but they've, it looked at these various school board races that happened across Florida and found this New York-based PAC was supporting many of these like Moms for Liberty candidates across the state. And a lot of money was being funneled into Florida to win these school board races. So I know this is like the most depressing talk ever. Sorry, guys. Why is this all happening? I ask myself this a lot, and I don't, again, have all the answers here, but as best as we can tell, one of the big kind of groups that really got a lot of the anti-trans legislation running was ALEC. And I can't even tell you right now what ALEC stands for, but they are basically a big group of lobbyists. And ALEC then joined forces with all of these other kind of right-wing think tanks, right-wing lobbying groups, and created what is called the Back to Neutral Coalition. And so what kind of initially was this anti-LGBTQ going after this very small group, this trans group that most people could kind of get behind marginalizing, it's now spreading, right? And they're saying that their kind of mission, their initiative is to get back to neutral, which means we don't talk about race, we don't talk about discrimination, that is going to be erased. That's kind of the goal of the group. And part of this movement, many of you might have heard of Christopher Rufo. He's really identified as kind of the main guy for really pushing this idea that critical race theory has infiltrated school systems and, these private companies. Christopher Rufo was basically a failed politician out of Seattle, and he was doing documentaries on the unhoused population there, and they were all from this, again, very right-wing kind of think tank perspective. And there were a number of groups within Seattle that advocate for the unhoused population that kind of went after him and said, this is racist, what you're doing. And so from being called a racist, obviously he did not react well to that. And that kind of created this movement for him to really unearth this critical race theory phenomena that he believed is happening. And he's the one who's kind of taken this to like a national platform. He's very vocal on Tucker Carlson and those types of platforms, talking about how this is taken over. And I think reading between the lines, it's a means of creating mistrust in public institutions, right? And we know that fear drives a lot of voting, a lot of decision making. And so it seems to be working to some degree, right? And I already kind of mentioned this. Is it new? Is this a new thing to have this like moral panic in schools? No, right? So there was the super predator stuff. This feels very much like history repeating itself. So back under George Bush, the first one, there was a lot of talk at that time about getting more African-American history in schools. And the pushback against that was this National Standards for U.S. History campaign, where they basically wanted to create a history curriculum that would be celebratory as opposed to maybe accurate, right? And so this is not new, and this was actually part of some of the Don't Say Gay bill. There's actually pieces of this talking about like creating good American characters in schools through character education. And we were recently informed that Casey DeSantis is coming up with her own mental health curriculum that we believe will probably be along these lines. So it's not actually a mental health curriculum. I think she's calling it like a character education curriculum program. We don't know what this will look like, but it's coming. So that was a lot. And I'm going to just stop sharing my screen here, but I'll give you a second to take a screenshot of my email. You can also just find it at UNF if you want. And I leave with this quote too, and at least this portion with this quote that, Toni Morrison talks about how the very serious function of racism is distraction, and it's meant to keep you from doing your work. You have to explain things over and over and kind of spin out. And a lot of my colleagues who do this kind of work around disproportionality, but obviously even other types of discrimination, kind of talk about that a lot related to this, right? Like, if we're focusing on this and trying to, dispel all these myths, what are we not doing? So it's just a thought to kind of end that portion on, but I'm definitely curious to hear your thoughts and questions and criticisms, all of the things.
Okay, thank you, Angela. Thank you for that was wonderful. I appreciate everything you had to say. I have 12.5 questions for you, but before I start asking any questions, let's go to round the room and see who has something to say, comments and questions. This is the time. And I see Denise. Go ahead. Denise.
Well, I just want to thank you, Angela, for what you do. I give you a lot of credit. I don't know how things got this way, but what bothers me is, being a feminist for all these years in my life, our side, if you will, and I hate to say that, but our side seems to be reactive instead of proactive. And this to me is across the board. We wring our hands, we try to react to what they're doing. And you'll excuse me for the phrase here, please, because I can't really express it any better. Where are our crazies? They've got their crazies and they're taking over everything. Where are our crazies to avoid this stuff and get started? I mean, just as a small example, we knew Roe v. Wade was going to get overturned. I knew this 15 years ago. We didn't do anything. Okay, we wrung our hands, we put up posters, whatever. We were not proactive. We did not put in trigger laws like the other side did. And this is my frustration with, quote, our side, the side of reason. We are reactive, and I don't know how to help you. I protested, I've marched, I've testified. I am beside myself, and I'm sure you are too, but I give you so much credit for what you're doing. And thank you for that presentation.
Thank you, Denise, for the question. Angela, where are our crazies?
That's a good question. And I grapple with this myself. I mean, I know many of you might be with your families for this week. And I think this is a time when families come together. You don't pick your family, right? And we've kind of had discussions about like, how do you convince people who are just out there? I've actually started seeing clients who are like, my parents are into QAnon and I don't know what to do with this, and you can't reason with them because it's not based on reason, it's based on emotion. And I don't know so much about the preventative crazy part, but I think you're right. Like, I think we need to kind of be hitting this from an emotional place. We need to be, really talking about the stories of people impacted by this. And what critical race theory would tell us is call it out, right? Be probably equally crazy, to speak to what you're saying, and just say, like, this is racism. That's what you're doing here. That's the bottom line of this. But having a platform to do that and doing it in a place that feels like there could be some very serious consequences for you becomes very tricky. I wish I had answers for that, Denise. I hope other people in this room do.
Well, let's before we go to Angie Duchess, when we talk about where, Angela, this is for you. When we talk about where are our crazies, aren't we talking about mental health issues as well? And don't we have to put that up against a backdrop where we are not trying to be the crazies? We're trying to be a path of reason. And it's a much slower path. It's a much more difficult path. But is that fair to say, or am I making a mistake in?
No, I mean, I think if I'm catching all of the nuances of what you're saying, yeah, first, I mean, obviously in the mental health field, we don't like to use the term crazy. I was kind of going with what you said there, Denise, but yeah, I don't know, Ken, if you were maybe implying that there is like a mental health aspect to some of these beliefs, like the QAnon beliefs, for example. That's very controversial in my field. But there certainly is a psychological component to all of this kind of cultural warfare, right? And yeah, I think there is this piece of this that does have to come back to reason. And reality is, talking through all this data, reality is kids are suffering with mental health. So if you don't want social emotional learning in schools, how do we address this, right? I mean, that is one approach to this, but I do also think that we have to also work the emotional side of it, which I think is not as intuitive maybe for people like us. And what I mean by that is telling the like personal stories. And what was heartbreaking for any of you that went to the Duval County Public Schools board meeting where they were talking about the resolution to support House Bill 1557 is that those kids told their stories. They said the personal impacts of this, right? And I mean, I personally, as a mental health provider, was thinking of the trauma that they experienced, then hearing the other side of that when other parents spoke up and basically were like, I don't care. But I kind of think it needs to be both. But I'm open to all strategies, Ken. So this is where I'm not the expert.
Right. Okay. Well, right. All right. There's a lot. You said a lot, and there's a lot of follow-up questions. But let's go to Angie.
So I have a
Duchess.
question for you. Do they still teach math in school?
Yes, they do.
Because there seems to be a lot of discussion about teaching about racism. That's not why I send my kids to school. I'm sending them to learn arithmetic and reading and writing. And I don't know why they're being forced to learn about racism. That's not why I'm sending them to school.
Well,
That's a discussion for my home at my kitchen table. That is not a discussion at school. I don't know why we spend so much time on all this racism stuff at the school. They're there for 3 reasons: reading, writing, arithmetic. That's it.
Well, Dr. Mann, if you have enough time, perhaps you could recount the history of America. But given the fact that we don't have that amount of time, how do you respond?
Yeah, I mean, I would say, Angie, I wish we were talking more about racism in school personally. To kind of get back to what Ken is saying, we do teach history in school still, right? And unfortunately, the history of our country and the current history being made, exists with racism being part of that narrative and part of that story. And
Do you think in Japan they spend so much time talking about racism? Because we need to be competitive with countries like China and Japan and
I
all these
agree.
other that are really kind of outpacing us when it comes to technology and advancing. And I think talking about the past is like looking in the rearview mirror. We need to move forward, and that's a discussion for home at my kitchen
it's
table.
but it's not the past. And I think the other thing, when we talk about what makes us competitive with Japan, right, it's also the way that we treat all members of our society. And I would ask you, how much time do you think is currently being spent talking about racism in schools?
Oh, I think the whole day. I think that's all they talk about.
I would encourage you to volunteer in your child's classroom sometime, and see what things look like. And I would also encourage you to check out the curriculum and the state standards for education, because I can assure you that, unfortunately, this is definitely now not being talked about at all. But even prior to that, was barely discussed, if at all. So yeah,
I am
but again, there's
exhausted with this topic. That's all everyone talks about.
well,
Can I
imagine how
chime in?
exhausting it is to be Black. But
Well,
yeah,
well, I'm not saying there's any contention here, but Angie does raise a point, and that is when we talk about education, what do we actually want to be how do we want our children to be educated, and from whom do we want the education to be imparted? And if we're talking about public education, who gets to decide what the curriculum will be? And if we're talking about homeschooling, which Angie might have the ability to do, or maybe not have the ability to do, then you can educate in a different manner. So when you, Dr. Mann, speak about education in general, what are we talking about? What do we want our children, because everybody wants to teach our children, what do we want them to learn in terms of becoming productive, empathetic, understanding citizens who are part of our process in becoming a better community?
I think again, it's a great question, Ken. And it's a hard one to answer. What I can tell you is that in this country, we have always believed, unlike places like Japan, in local communities to a large degree making these decisions. So the state develops their standards for what we believe in our state is important to teach children. There aren't national standards per se, like there are in many of these high-performing countries. And again, when you look at how these standards have been developed over time, yes, it's dynamic, and it's influenced by the cultural zeitgeist at the time. And I think when you look at the current standards, especially here in Florida, they're very reflective of this cultural moment that we find ourselves in. But I think one of the things that you're bringing up, Ken, that I think is also important to consider is, individual freedoms for who? And who are we, who is influencing these standards right now in the state of Florida? Is it, standards that Muslim families, that atheist families, that LGBTQ children, that all of the people who pay their taxes to have their youth educated in public schools would find themselves represented in? And I'm not sure that we would be able to say that right now. So
Okay. Well, Kendra Lane, you have a question?
Hey guys. Well, I do have a dozen and a half questions, much like yourself, but what I wanted to reply for the discussion that is it Duchess brought up, Angela Duchess brought up that, you know, everybody is saying this, teachers seem to be doing this and so forth. And um like Dr. Mann's recommendation, just go and volunteer and be present and see what's really going on. I'm a career long educator. I've taught VPK, which we're one of only 3 standards to have universal pre kindergarten through 5th grade. And I am required to deliver a curriculum which was written above my pay grade. Teachers don't really decide what to teach. We decide what materials to use, or you know, how to disseminate that information, but what we're going to teach is dictated for us. So I just wanted to make sure there was no confusion about that. Also, gender or sexuality is not part of any curriculum that I've ever taught, other than when I taught 5th grade, and we did a unit on sexually transmitted diseases. Thirdly and lastly, I'd like to say, when we teach a child to be knowledgeable about human anatomy or how babies are made, that's not a moralistic thing that needs to be discussed only at the dinner table, in my opinion. And similarly, other sciences and social studies and civics issues are a part of the curriculum. So parents don't get to cherry pick what topics are going to be taught. I mean, I am required to teach social studies. I am required to teach science. It's not just reading, writing, and arithmetic. It's all of these topics, and depending on the grade level, like someone was saying earlier, social emotional learning is a very, very important part, for example, of early education, whether it's how to pass a ball without pitching a fit, or take turns with an object, or share scissors without pitching a fit, or how to stand in line and wait your turn for a drink. These are, you know, fundamentals of interacting in a school or in society in general. And so I don't think it's appropriate to say, I only want my kids learning this, that, and that. I mean, if that's the case, again, homeschooling may be a better option, but thank you.
Well, thanks, Kendra. And any comments? And Dr. Mann, any comments on that?
No, I just like having an educator's, you know, perspective on this. And yeah, I am glad to hear from an educator. You know, I know sometimes people say, well, teachers don't want to be doing all this mental health stuff, but you know, often one of the biggest cited reasons teachers leave the field is because of struggling to address the behavioral challenges in classrooms. And so it's great to hear an endorsement of that social emotional curriculum because it's critical. So thank you.
Thank you for your comments, Kendra. Dennis Lynch, and then we'll go to Jeanette. Dennis. Unmute yourself, Dennis.
There we go. Okay.
There we go.
I am a retired high school teacher, industrial tech, science, math, applied physics, engineering, networking, programming, all of the technical stuff. But I also included art, music, theater, film, history. I covered everything I could in my classes, because if you have somebody who can only take in information by reading and printing it back out and maybe manipulate some numbers, that's not human. That's a robot. And we need students who can do more than that.
Well, thank you, Dennis. I hope that I get some of your kids at UNF, because yeah, I can tell you there is a need for more dynamic, critical thinking. And I would love to see that being part of our standards and curriculum, but I think we're maybe going in the opposite direction.
But I was also teaching in Iowa.
Yeah.
Oh, well, Dennis Grassley area.
Yeah.
Yeah.
And yeah.
Yeah. Okay. All right. Well, thanks, Dennis.
Right.
Let's feel free to speak up again later, but let's go to Jeanette right now. Jeanette, any comments, questions?
Well, I just wanted to say, it seems to me that we have math classes, we have English classes, we have science classes, and we have history classes. In elementary school, you have different, it's segmented throughout the day. They don't go to a different teacher for each subject. And it seems to me that this whole business with it is such fear mongering by the right. It's just makes my head want to explode. And for people who don't want to teach history in class are doomed to repeat it. That's just an undeniable fact. It's not hyperbole. I don't understand why we wouldn't want history taught in class. I will say, when I was taught history in class, we were taught the Alamo, we were the good guys in the Alamo. We were taught the Indians were the bad guys at Wounded Knee. We were taught all kinds of things that were not correct. And I think we need to be aware that it is time to teach history.
Okay, Jeanette, Angela, do you have a comment on what Jeanette just had to say?
I mean, no, other than that, I agree with you. You know, I did have an opportunity when I was in high school to take an African American history class. And I, even at the time, kind of thought, well, it's really bizarre that I'm learning this whole separate set of history in an elective class. Like, why isn't this all together? Right. But yeah, I mean, the more that I grow up as an adult and realize that, you know, really the full picture of the country that I live in was never shared with me, it's had a big impact on my thinking as an adult, right? And being able to learn more about the actual history of the country has definitely helped me to understand our culture better. And I think that that to me is actually one of the biggest solutions to this culture wars issue, right? If we understood our culture and our history better, maybe we would be less prone to these culture wars. So yeah, I agree with you, Jeanette. Thank you.
Thanks, Jeanette. Now, Susan Erchter.
So I have a question. So I feel like what you said, and you can tell me if I got this wrong, is that you think possibly these culture wars are created by politicians to make people distracted and maybe get people angry at a subgroup. We've had, you know, I guess targets, like scapegoats or targets to distract us against them. So how could we change minds to make people more loving rather than having them be hateful? Like, so if the trans community is being targeted right now, how do we get people to understand that people in the schools are not trying to turn people trans? It's just something, people are trans. So how do we speak? Or even like, I listened to the school board workshop the other day, and Charlotte Joyce is saying she wants parents to be able to opt their kids out of listening to a session on trans identity. I don't know why she's so afraid of it. What is her fear? Because just because you talk about, you know, blue eyes, it's not going to make your brown eyes turn blue. So why is she so afraid of the conversation? And how can we convince her?
Yeah, man, I feel like I had those answers. I don't know, maybe be on like a yacht in the Mediterranean right now, right? Because I would, it feels above my pay grade, I guess is what I'm saying, above my intellect. But, you know, my instinct tends to be to use data and to say, well, I can show you all of this research that says that, being LGBTQ or trans, gay, right? This is not like, there's no contagion that happens. You can't, if I wanted to, teachers have kind of joked, like, if I wanted to indoctrinate your kids, they'd be showing up to my class with deodorant on and have their, homework ready. We just don't have that kind of power, right? But what I know from you might want to talk to the social psychologists I work with, that approach actually tends to have people dig even deeper into their beliefs. Presenting data like that, trying to reason, pushes the polarization further. So, I think the psychologist in me then says, I need to try to understand more about where this is coming from. Like you said, Susan, like where is this fear coming from? What is your fear, right? And let's examine where this is coming from, how true this is. I think, the best that I've been able to see or do so far is to, invite people in and say, yeah, school-based mental health professionals have always believed in parents' rights. Parents are critical to mental health wellness interventions. We want you involved. So by all means, get involved. Like, let's talk more. Tell me more what this means to you. I don't know that is the perfect solution. I think what Ken said, this is, we think about the school to prison pipeline, and it took us decades to start undoing some of that cultural thinking. But yeah, maybe my social psychologist friends would have more answers for us here. I don't know that I have great solutions other than to just try to ask lots of questions. What does this mean to you? Where have you seen this, right? In my neighborhood groups, this whole schools are indoctrinating kids stuff has come up, and I've said, can you tell me some more about what you've seen in your kids' curriculum or in their homework or their classrooms, or that have made you feel this way? Like, tell me some more. And the conversation tends to die. So I don't know if that's helpful or not, but these are the strategies I've been trying. And like I said, I also think, even with those parents that were then able to kind of say, really hateful, discriminatory things at that resolution meeting, those youth who spoke up and said, this is how this is impacting me. I have friends who died by suicide. I have, friends who've considered suicide. I don't know how you cannot be compelled by that at some level, and I think we just have to continue to do that. But I would open this to the floor I'm sure we're all dealing with this in our own individual ways, maybe at the Thanksgiving table this week, if that's what you celebrate, right? So yeah, by all means, please chime in.
I just want to, if I could say one more thing super quick. This is Jeanette again. I think the goal isn't to teach guilt. It is to teach compassion and understanding. It's to help people walk in another person's shoes for just a moment throughout history. It is to understand why things happened the way that they happened. Guilt is not a thing I've ever taken away from history.
Okay, thanks, Jeanette. Mary Wall, your hand is up again. If you have a question, a comment.
A comment.
That's right. You got early tomorrow, right?
Yeah, probably.
Okay.
I'm going to, I guess, express an opinion that basically, I guess, not everybody would agree with, but I have, I'm a centrist Democrat, but I do not agree with, I guess, progressive agenda at all. Among other things, the idea of see how it feels. To a certain degree, I suppose they're legitimate, but that I guess even in terms of operant conditioning, that basically, I guess one person should, basically, be in terms of reward and punishment, be, I guess, given the impression, basically that somehow they had the control over how the world worked, or, basically even that they should be the ones to, I guess, get the feedback with regard to somebody else's actions. All over the place, not just progressive, but I see a lot of lack of accountability for anybody's actions. But how does anybody learn their own limitations, or, get any legitimate feedback if they're constantly exempt from doing so? And why another person should be constantly held responsible for somebody else's actions that more or less, that's somehow their primary responsibility instead of that of the person that actually does it or something. Anyway, I do not see how, in terms of mental health, that's really in any way effective. So, whatever.
Okay. Is there a comment, Angela?
Yeah, I mean, I think actually, Mary, there might be more common ground here among us than you might even think. I agree with you. And actually, one of the things that, critical whiteness theory or critical race theory talks about and teaches us is that, like, you really do have to start with yourself and taking, I wouldn't use the term responsibility necessarily, but taking initiative to be self-reflective on your own place within the system and the way that the system has influenced you. And so, yeah, I think that I wouldn't say that, it is about blaming one particular person or having them taking responsibility for things that have happened in history, but rather looking at our place within a system and how we can influence that system to change and benefit everyone. And
Well, I was raised in upstate New York, and having been a member of the southern part of the country, at least when I was in, I guess, elementary school, the idea was basically the North had more or less won the war, or whatever. So it was written from that perspective. But basically, I guess, the Civil War history was taught or whatever. And the entire perspective, even then, was that basically slavery was terrible. And basically, I agreed with it. But, for some reason, I guess I more or less realized racism existed. But, I thought more or less that basically that was status quo when I was in elementary school. And that more or less I really couldn't do anything about it. Most of my life, I've been more or less colorblind with regard to individuals within a system, whether they're black or white or whatever. But maybe I really didn't actually do anything really about it. But, I didn't really think I could. I really didn't think I had that ability. But
What's your question, Mary?
I'm just saying, a few years ago, somebody was in a pulpit, I guess where I was attending church, and she was more or less saying that the North did not recognize, basically their own attitudes or bigotry. I more or less did agree with that to some degree, but even if I expressed anything, I seem to be more or less attacked. So whatever I really in terms of making that my particular mission from God, basically, I admit it. I admit it. Basically, in terms of doing nothing, I really haven't wanted to, I guess, to incur the wrath of whatever. So, and really was not one of my particular missions from God, although basically I never really considered myself racist at all. So basically, I'm just, I guess, saying basically what my past perspective has been with regard to, I guess, the imperative to get involved. So whatever.
Okay, very good, Mary. Let's go to Kevin.
The discussion earlier about or part of this discussion regarding the teaching history that's true, that without taking out the parts we don't want to remember, reminded me of a book I read a few years ago by Jared Diamond. He's written a number of books: Guns, Germs, and Steel, Collapse. This particular one was called Upheaval, and he did compared and contrast a number of countries, two of which were Japan and Germany, and specifically looking at them since World War II. And one of the things he brought up was, what do they teach their own people, their own children in school about what happened during the war? And it was hugely different. Japan does not teach about the Bataan Death March. Japan does not teach about the massacre of more than 100,000 Chinese at Nanking, of a lot of the brutality that went on. They do talk about the Americans dropping the bombs, and which is fine. That's part of the war. But the children are taught nothing about or at least very, very little about the atrocities that a lot of the Japanese soldiers carry out. You contrast that with Germany. Germany is extremely open with their school children about what happened during the Holocaust, the atrocities that the Nazis carried out. And it's just, that there's an awareness there from a very young age in Germany of this happened here, that, and it's an acceptance of that. I don't think it's a guilt trip. Somebody was talking about, guilt trip doesn't serve a purpose. And I agree with that. But that awareness and acceptance, and knowledge that, okay, this happened here. We don't want to ever let that happen again. And if you're interested in that book, it's Jared Diamond is the author and Upheaval is the book. But it was really interesting contrast between those two countries.
Comments, Angela?
I've added those to my reading list. Yeah, I think I wish I were a social psychologist and an ethnographer and an anthropologist, and I see that he's a geographer, right? Because I feel like that's what we need, is all of those folks, historians, to be kind of weighing in on this and helping us understand it. I know to some degree it was almost reassuring when I saw these educational historians say, we've been through this before. This happens, right? So, but I think to be able to look to other countries and see how they've reckoned with these types of culture wars maybe more successfully than we have would be interesting too. And I know that's different from what you were describing, but still, I think it helps to inform how we think about moving through this. So.
Right. Yeah. And one of the points was that, the Japanese children grow up with a very warped, very, very unrealistic or inaccurate view of what happened in history and things that, happened during the Second World War. And how's that going to influence them as future leaders of their country and citizens of the world in terms of their perspective. So, yeah.
Thank you, Kevin. Before we go to Kendra again, I have a question for you, Angela. The idea that mental health is supreme, at least very important in the whole formation of critical race theory and the idea that we can embrace other people and we have compassion. But then we go to Columbine and we look at what happened there, and then we go to what happened over the decades now since Columbine in terms of school shootings, something where you have spent a lot of time, I presume, studying why these people decided they're going to stand in front of a room and shoot people or kill people in other ways. And they're young people. And we talk about mental health because of these events, and we talk about mental health as if we understand, well, they're just not mentally right. My question is, how do you decide what is mentally right? Do you have success stories in terms of your counseling, in terms of what you've been involved in that prevented these kind of horrific events?
Yeah, and I know I saw that Elizabeth Anderson is on the call. I know she's a mental health professional as well. So feel free to give me some backup here. This is it's very, I kind of alluded to this earlier. It's very controversial within the field of mental health professionals, all of the layers of what you talked about. So in terms of knowing what's mentally right or what is actual mental illness, there are, debates about how well we do that. There are debates about whether it's good to do that. And we could definitely get into all of that. But to talk specifically about school shootings, I also alluded earlier to the fact that the narrative, the cultural zeitgeist tends to get into talking about mental health recently, right? When we talk about school shootings and that, I think that is a bit of a mistake. And the reason I say that is because when you look at the Secret Service reports where they have profiled these school shooters, and there's another book that came out recently that I can't think of, but I'll look in my my list and see if I can find it and send it to the group. There in some ways kind of is no profile, basically. So what we see with these kids is the biggest commonality is a history of bullying. It's a feeling of being ostracized, and there are some obvious commonalities. So they're very overwhelmingly white, male, right, and have access to guns, oftentimes semi-automatic types of weapons, right? And beyond that, there really aren't, we could say, like, common themes or threads that are very apparent that we can look at kind of like a screener and say, oh, this kid's definitely going to be more at risk. Now, we do have threat assessment tools we use where we can kind of engage as a team in evaluating how risky a student is towards perpetrating a threat like this, right? But there's no like mental health profile of a school shooter. What folks are starting to kind of talk about, there's a narrative brewing about, is again the cultural influence of this. So I showed you that data earlier. We're seeing these huge kind of increases in these incidents. And certainly we know that, I think media is playing a role in this. And you might have noticed that in these recent events, like in Colorado Springs, they're now no longer publicizing who the shooter is. It's very difficult to even find a picture of them. And they're trying to kind of keep a low profile on, giving a lot of attention to these shooters, because we know now that much of that drove some of these events, seeing these other school shooters and the notoriety they got. Many of these school shooters study school shootings and school shooters at length. We know that from the trials with the Marjorie Stoneman Douglas case, that he had spent a very long time studying school shootings and kind of this dark webs information about this. So yeah, I mean, I think that there are some people in my field who would say, well, it's got to be a mental illness that this person has to be able to perpetrate something like this. There are others who would say, well, it's this culture of kind of toxic masculinity and some of the things we're talking about tonight, like not being able to identify emotions, not being able to learn problem solving, not being able to get good social skills training, not knowing, how to deal with bullying and the ramifications that come from that. And all of it kind of manifesting as this like hyper masculine, getting a big gun and enacting revenge on all of these people that, were viewed as harming them or ostracizing them. So it's a complicated answer.
Well, in terms of successes.
Oh yeah, you did ask about successes, sorry. I would say, specific to school shooters, is that what you're thinking of, Ken?
Well, that was one example, but if you have any example of successes, I'm interested in hearing.
Yeah. I mean, I think that what we can see is even in cases of kids with pretty significant kind of antisocial or conduct-related behaviors, for a while it was difficult to treat those behaviors, right? But we have tools now that are largely relationship-based, that we've seen good progress for kids on that more kind of extreme end of pretty significant behavioral difficulties. The kinds of kids that you might think of as, again, being more antisocial or perpetrating laws. And I see Elizabeth also, she just asked me, can you talk about trauma? Yes. I think another big thing that we're also starting to understand better, and there's been a lot more discussion about in schools, is trauma histories for kids. And so even looking at kids like in the juvenile justice system, for example, I think the most recent data is something like 90% of those kids having a number of traumatic events in their life significant enough to create or warrant a trauma diagnosis, essentially. And so, you know, again, it kind of speaks to maybe even the very first person who said, like, we're so reactive. Yeah, instead of noticing that these kids are, you know, experiencing trauma, which is resulting in them acting out. Maybe it's trauma from bullying, maybe it's trauma from events happening in their home or in the community, like witnessing gun violence. Often I've seen kids where they've never even seen a school-based mental health professional, and they're already at the alternative school, or they're already in juvenile justice where there's no mental health treatment, right? So the successes are when we identify those kids early who, you know, are exhibiting these behavior difficulties. We know that there's kind of a critical age right around kindergarten, actually, which stresses the importance of things like a kindergarten transition program, where if we can act early and get really good services in place, where we can teach parents different ways of responding to the kids, we can teach teachers different ways of responding to the kids, we can help them to understand the trauma and be more trauma informed in how they approach things. These kids show really phenomenal outcomes, and it matters in the long term to things like employment, to things like, you know, our carceral systems, which are expensive for us as a society. So it would be way more cost effective if we were preventative to get, I guess, go full circle. Hopefully that answered your question, Ken. There was a lot.
Well, thank you. It's okay. I got a lot of follow-ups, but let's go to Kendra and hear what Kendra has to ask or say or make a comment. Kendra.
Thanks, Ken. Gosh, we've talked about a lot of things since I raised my hand, but going back to the idea of guilt, since nobody alive today was present during these painful aspects of our history, or certainly wasn't alive with a lot of agency at that time in their life, I don't really think that guilt, you know, is something that we need to take away from American history. It's also, you know, we don't really even have to say why. I mean, I'm not sure anyone knows why history evolved the way it did. It's not so much, you know, feeling or why, just simply these things occurred. And then, you know, maybe teachers at this time under DeSantis have to avoid why altogether. But in any case, you know, I'd like to say, I saw in the chat someone said teach epistemology, which you're obviously onto something, or critical thinking skills. The thing is, how do I know what's accurate history? I mean, how do I know anything? How do I know that the American Revolution happened, or that my own birth even happened? I don't remember it, you know. And when I really am interested in that author, the piece someone was talking about, Jared Diamond, and I'm not sure if that was the same person who brought up comparing Germany and Japan. Those are really great countries to compare for the reasons people were pointing out. One noticeable difference between Germany and the United States is that, like, Holocaust remembrance, like those concentration camps that are still standing, exist in their place of origin. They were not, well, when you look at the United States, for example, here in Jacksonville, Florida, we have Confederate monuments erected by the Daughters of the Daughters of the Confederacy, to put a spin on it. And so I think there's definitely something here, you know, leaning into the culture wars, because some people, you know, are on one side of this and others are on the other. And so when we look at history, of course, we want to look at the primary sources, or the best sources we can find. And I would personally argue that the Daughters of the Confederacy are not the best source of information, and that maybe, you know, some of the founding fathers or other people who are more well, researched or documented would be better narrators of things that had actually happened or people who are alive today. And so I think that because, like Angela mentioned, primarily white property owning men wrote the narrative for so long that it really tended to exclude other people than, white property owning men. And so to bring in, I know Angie Duchess had said, we should be focusing on reading, writing, and arithmetic, but schooling is much more. Schooling is not so much a topic as improving one's critical thinking skills and their ability to reason. And so if I show you a Batman museum, how do you know that's a different type of museum than a museum full of dinosaurs or something? And, that kind of thing. How do you figure out, how do we know, going back to the epistemology thing, how do we know truth from non-truth? How do we know
Kendra,
that?
Kendra,
Yes.
Kendra, when you just said, how do we know truth from non-truth? We have to invite Angela back for another 2 hours to have her explain how we decide the truth from no truth.
Absolutely.
I mean, it's a huge question. You made several great points in your comments. We're running out of time, Kendra. I don't mean to be seeming like I'm cutting you off, but we do have some other folks. We have just a couple of more minutes before we're going to end this, and I appreciate it. Do you have a final question, Kendra, for Angie? If not,
No,
that's okay. That's
I don't.
okay. That's fine. I appreciate your comments. I'm going to ask a question of the room before we wind this all up. And you can all unmute your mics at this point if you'd like to respond to my final question. And this is not just a specific question to Angie, but it's a question to the room. And it's relative to Ron DeSantis. Would we prefer to see Ron DeSantis stay governor or become the president of the United States? Go.
You mean Yosemite Sanders?
There's a word for that. It's called Hobson's choice.
Say governor, we'll take one for the team.
Take one for the team. Keep them here in Florida.
Keep them here, yeah.
I'll go with Plato's philosopher king dilemma.
Could be just harder to
Right. Right.
Yeah,
to see
neither
that.
one. I picked option C, neither one. Let him fade into the distance.
That wasn't an option, but fair enough. Okay.
Let DeSantis troll Trump and DeSantis pull each other apart. Let Trump run a third party, and hopefully Democrats can come up with like a viable candidate.
Mhm. Okay. Because it sure does look like the boy's going to be running for president. Harvard, Yale, he's got a lot of credentials.
Do we not have a resign to run law in Florida?
I'm sorry, I missed that.
Do we not have a resign to run law in Florida? DeSantis would have to resign from the governorship.
Oh yes,
to
yes,
run.
it can't be both. Right.
Yeah, well then he can be defeated if he runs.
Oh yes, he can be defeated if he runs for president. Certainly,
Yes.
he might not. If he runs, he's got to win the Republican primary, and he might not win that.
But he would no longer be the governor.
I don't think he has to resign to run. I think that's only
No,
certain.
not to run, but to become the president. He has to resign to become the president, but not to run.
Oh, it used to be to run. But I don't know that, so I'll shut up.
Right. Right. Angela, you care to weigh in on this?
It's all terrifying to me, but I did have a friend, I'm guessing that's not actually your name, Daphne, but I did have a friend who said the same thing to me. She was like, look, this isn't altogether terrible. Imagine if Trump had thrown all of his support behind DeSantis, right? Like that would be catastrophic. So it's not you know, there's still some hope, I guess. And I do think there is a resign to run law here in Florida. And I happen to know from our lobbyists that the what do you call it? The lieutenant governor, who nobody knows, they're in a big campaign right now to try to get her name out and get her more public facing. So they're gearing up for sure.
I didn't vote for him, but I was a huge fan of Perot. Let's just say it that way.
Okay. Well, Angela, we really appreciate your time, your expertise, and your willingness to entertain our questions, as brilliant as they all were, and as so I really appreciate your time and wish you the best of everything as you move forward in your career. Are you familiar with Michael Hallett?
I'm not, but another person to look
Michael
up.
Hallett wrote this book. He's was a UNF professor, called Private Prisons in America, which deals very, very closely with the prison to pipeline. That's a whole nother discussion we could have gotten involved in, relative to why the profit businesses are creating in part the school to prison pipeline. So, and he details this. This is a book maybe written 2006 or so, not recent, but still valid information inside there. A fellow UNF alumni. At any rate, lots more that we could have chatted about, Angela, and I appreciate everything that you had to offer. And I appreciate everybody's comments and everybody's questions. And at this point, Angela, I just want to thank you and give you a quick applause. Everybody, thank Angela. If your mics are unmuted, say thanks. But if not, just understand, Angela, Dr. Mann, we appreciate you and we'd love to have you come back.
Thanks. Yeah, I will definitely be joining as an audience member in the future. This was very thought-provoking for me, so thank you.
Okay. Well,
Thank you, Angela.
Thank you, Angela.
There we go. Then now I turn to Madeline, who somehow has the magic button to end the meeting. Madeline, it's up to you when we do that.
All right. Good night, everyone. Thank you.
Good night.
Bye.
Good night.
Good night, thanks.